So it's hard for you to roll out of bed in the morning. Every time you stand up out of a chair, your back is killing you. Well, let me tell you, it doesn't need to be that way. And I know because I've been treating myself and my clients for over 7 years. My name's Tyler Ippoliti, and I've formulated what I believe to be the best and most complete way of treating low back pain. So those things that you want to be able to do, play with your kids, get out of bed in the morning, just do fun things without having pain, can be solved. And here what I've provided you is a free video to at least check out what I have to offer. And if it resonates with you and you feel like you don't want to be in pain anymore, check out the full mapped out course, and you're going to have some answers and some tools to be able to treat your low back pain. So I hope you enjoy, and thanks for watching the video. So in talking about low back health, one of the first things we have to talk about is how you breathe. I had this brilliant idea the other day, and it was that the breath is the one rep that we constantly repeat more than any other rep out of anything else that we do, as far as walking goes, standing goes, squatting goes, whatever you do, bench press, if you're into big pecs, you still breathe more than you do any of that. And if you're doing it wrong, it's a lot of muscle use and poor postural patterning around those bad reps. So basically this first piece of creating low back health is how to manage your breath. And the reason why the breath is so important as far as low back health goes is because the diaphragm actually controls how much of your musculature in your core works. And obviously your anterior core musculature controls how your spine works. So if none of this is working, then none of this is working, and then you'll experience pain here. Now, as far as this breath goes, again, I'm going to breathe in and out of my nose, and you'll see my breath rise first in my belly and then into my chest, okay? So I like to put a hand on my belly button just so I can feel and gain a connection with how that's working, and then my other hand is on my chest, okay? So I'm going to be neutral in my spine, my head. I'm going to breathe in through my nose, and you'll see that the final part was in my chest. Then I'm going to exhale. And that exhale is super relaxing. I'm not pushing out, I'm not really exerting myself in that, but you'll notice as I exhale, my belly button and hand are falling. Again. So now we're going to travel up the chain a little bit, and we're going to start to work on the hip flexor. So what's commonly referred to as the hip flexor is actually one of 4 hip flexors. It's called the TFL, tensor fascia lata, whatever. So it's in the front corner of the hip. The way I like to teach people how to find it is if you come to a kneeling position and you kind of grab the front corner of this meaty place of your hip, okay, that's where the ball goes. It can be a tricky place to find for some of you, so definitely try to get into this position and then poke around to find that muscle in the front of your hip. Now for this location, you can use a double ball or you can use a single ball, okay? Both big and small, so I could take these out if I need to. You can have a lacrosse ball, okay? Any ball size works. Really depends on your frame and how much pain you can tolerate in this particular position. So I'm going to use this big supernova here. Thank you, Dr. Kelly Starrett. I would not be living without this ball. So as I showed you, I was in this kneeling position, front corner of the hip. You're going to find that spot. The ball is going to go there. You're going to lay in this semi-oblique position. So I'm on like a side plank kind of position. I have my leg out in front, kind of holding some of my body weight here. You can bring the foot out like so, fully extended leg position out like this. You could be here. It really doesn't matter. Find a way to drape the front of the hip over the ball. Okay, so I'm holding with a hand. It's pretty tender for me today. Okay, now I'm not on the front of my hips. See, a lot of people will lay square to the ground in their hips. I'm more open in my hips, and my side is going into the ground, okay, rather than my face. Okay, so I'm there. Now, just as before, and you're going to get really comfortable with this method, we're going to contract and relax on the ball after about a minute of just relaxing. So I'm breathing in my stomach, super relaxed. Then after a minute, I do my contract, relax, and that's gonna look different for this position. So what I'm thinking of is pushing my left leg, my bottom leg down into the ground. As I do that, I'll contract the hip flexor on top of the ball. So let's see what you see. My left leg is pushing down. Contracting, relaxing. Take a big breath in, contract, and relax. And I'm doing that for anywhere from 1 to 3 minutes. And because you like to see my backside, I'll do this side just so you can see from this position without breaking the mic machine thingy, whatever it is. So I'm in this oblique position on this side. As you go along with these techniques, with these self-massage techniques, you're going to start to recognize and feel exactly what each particular muscle feels like. Sometimes, and everybody's body is different, you'll have a nasty referral. So like if I'm in my hip flexor and it's really bad, sometimes I'll feel it referring down my IT band or maybe even in my calf. That's kind of how trigger points work. So the next piece up the chain is going into QL. Okay, we have 2 more spots, so bear with me. I know we're taking a little bit of time here. This is going to relieve a lot of the pain that you're experiencing fairly immediately. So with a QL, also, well, the actual name of it is quadratic lumborum. Just stick with QL. You can use big balls or small balls. The big ball I find to be a little bit too gnarly for most people. And again, all these recommendations I'm giving you are based on things that I've learned with my clients and with myself. So this one, the double ball, tends to be a little bit more helpful. So we're going to find the spot on our back that is below our last rib. You can see my finger kind of tucking in under that. And then above my pelvic crest here, okay, thumb is at the pelvic crest, my index finger here is at the bottom of my ribs, and in between there's this space. You can see where I'm pushing into my body with my thumb, okay? So the double ball is going to capture each side of that space. And that's kind of the nice thing about the double ball, is that it's engrossing and encapsulating that space where the QL lies. And then we're going to have our feet elevated on something. Chair, couch, bench, wall. The wall works nicely for this. Okay, so I'm going to elevate my feet. I'm going to roll the other direction to scoot the balls right into that space. Then I come down. Back relaxing onto the balls. If I want more than just staying neutral, I let one knee fall down. That compresses it. If I want even more than that, the second knee comes down. Now here, like we worked on the psoas in the previous video, I mentioned how freaking important it was to be breathing properly. This is as equally as important as the psoas we did in the previous video, okay? It's a very soft tissue that works with the breath, okay, with the diaphragm. Okay, so I put my hand on my stomach. Sinks deeper and deeper with each breath, each exhale. You can do some contract relax here as well. It's a kind of a weird area to think of contracting, but you got to think like if you're standing up and you want to show your butt to somebody, you're like, oh, look at my butt. It's kind of like that. You're kind of arching your back and twisting a little bit to feel the muscle contract. Let your body, your intuition kind of tell you how you contract that muscle on top of the balls, and then relax. You don't need any tools for this one. You could just sit in what's called the 90-90 position. So the 90-90 position is going to be here, 90 degrees in my knees, 90 degrees here in my hips, 90 degrees in my front knee. I'm also pulling my foot up towards my shins, not putting my toes down, okay? From here, I'm gonna be really tall in my posture and staying square to this front knee, okay? Now, some crampiness can be happening back here in the hip. You may feel some weird things in the obliques. Try to bear with it. If you need to shorten the angles a little bit, you can do that or slide the foot in. That's fine. Optimally, you're here in that perfect 90-90. Now from here, once we're square to this knee, we're gonna stay tall and we're gonna hinge forward over this knee. The most important thing is how flat your spine is here. Okay, so I'm gonna hinge forward, bend over this thigh, but my back is staying very flat. This is the activity, the active stretching that I was mentioning. You're staying firm, but as you lean forward, you're feeling the stretch in this glute. Sometimes in the hamstring, IT band, but definitely in the glute. And you're just cycling back and forth like that, staying tall, not allowing any rounding of the spine. This would be a poor example. See how far I can go? It's not about how far you can go. With low back pain, passive stretching like that, where you're folding the spine, is generally not a good idea, especially if you have herniation. So stay active, stay tall. We're gonna do what's called a posterior pelvic tilt. Really not complicated, especially laying here on your back. But we're gonna incorporate the breath. Okay, we're gonna inhale first. Belly rises as I inhale. Now as I exhale, I'm pursing my lips just like we did. My belly button is gonna drop, but this time my pubic bone is gonna pull towards my sternum. So inhale first, exhale, belly button drops, pull pubic bone towards the sternum. So I'm doing this kind of crunching motion, but my legs are not being used. Although my hips look like they lifted, I'm using core, okay? Specifically TVA rectus abdominis, okay? You'll notice that my hands became closer together. And then I relax. Do it again, inhale. Exhale, belly button drops. Belly button pulls down, pubic bone towards the sternum, squeeze. Still exhaling. And relax. Now you can really make yourself sweat with that, okay? You can really squeeze hard. I do this is like my go-to core exercise because I can just lay there. I don't need to do much of a warm-up, and it's gonna really activate everything the way I need it to, especially before a workout, okay? But obviously we're aiming for low back pain, so it's great because it gives you kind of a natural spinal traction to relieve all of the pain you could be experiencing in your back. So I'm at about a 90-degree angle in the hips and the knees. My feet are hip width apart, okay? Not shoulder width, hip width apart, okay? So we're not gonna do the pelvic tilting the entire time we go through this motion like we did in the previous bridges, but you're gonna do it once. So if you wanna practice the breath with it, I always recommend that. Inhale, pelvic tilt once, pulling the sternum towards the pubic bone. Notice my hips begin to come off the ground a little bit. Once you can't go any further here, you push through the heels to activate the glutes and lift your butt just a little bit more, okay? And you're just hovering here. So you're pushing through the heels, feeling those glutes and hamstrings activate, keeping this engagement. So I'm really squeezing here and watch my breath as I hold this position. Like I said earlier, there's no posterior chain engagement without anterior chain engagement. So you gotta have all this to be able to do this, okay? With a band, the only thing differently would be to add a little abduction and glute medius engagement by pushing the knees out as you do that. And then same thing, you're lifted, okay? Pushing through the heels, feeling the glutes. This is gonna get more activation in the lateral part of the hip and breathing here. So the first one we're going to talk about is sitting because we're all doing it so much. So I got this chair here. And what I'm offering in these videos is how you can prevent so much damage when you're holding yourself in certain positions, okay? So sometimes you can't get around sitting. I just drove to Oregon and back, 8 hours both ways, got back is super sore. But there are ways that when I was driving that I could kind of alleviate some pain and also work on my mobility at the same time. Now, one of the easiest things to do is very simply, you've heard this before, when you're sitting or standing, pull the shoulder blades back, okay? Not up, but back. It's kind of a down and back too, so I'm just going back and down. Sometimes having your hands at your side is really helpful, and turning the thumbs out, kind of anatomical position style. If you're sitting at a desk and you have space along your side, that could be pretty helpful. Just opening your hands up, okay? If you're in a car, you really can't do that, but you can practice as my hands are here on the steering wheel, I'm pulling my shoulders down and back, not forward and up. It takes a lot of practice, but you're just gonna keep them down a little bit more relaxed as your hand is on the wheel, or even better, if your hands are lower on the wheel, that'll allow you to keep your elbows down a little bit more and shoulders down and relax a little bit more. So in doing this with the shoulders, I've already begun to open my chest and open my body. Another huge part of the posture and how you're holding yourself, and yes, all of this affects the low back. If I'm crouching because my shoulders are tightened forward, it will eventually stress the low back, okay? Even the head, which is this next piece. So I'm here, I have my shoulders down and back. To align the neck, I'm pulling my chin back to make a double chin, and you'll notice that my mouth is closed. I like to keep the tongue on the roof of the mouth as well. Looks like this. And in doing that, it's actually kind of a nice exercise. It is semi-active, all of these are, is I get a nice little traction right at the base of my skull, because I'm actually stretching this area. If my posture is bad, my shoulders are being pulled forward like this, what tends to happen with the neck is the neck will have to be up and flexed in this position, or I should say extended in this position, and the chin will be up. I'm sure you've seen tons of people with posture like this where they're hunched forward, their head is up, they got a rounded spine, okay? So to begin to correct all that, as I mentioned, shoulder blades back, now pulling the chin back. Double chin. I know it's not super sexy. You don't need to do it all the time, but if you're at work or you're driving, just pull it back a little bit. Now, as far as what you're doing with the actual lower half of your body is more difficult. So some of us are super tight in the hamstrings and they can't do what I'm about to offer, which would be stick your tailbone out behind you more. I did this little anterior, it's called an anterior pelvic tilt, where I'm sticking my butt back behind me. That's hard for me because I have tight hamstrings. But you want to do that just a little bit while keeping your abs semi-engaged, just so you can see the height and the posture in holding this position. Now, for some of us, this would be appropriate just to stay tall. Now, and by some of us, I mean especially me, this is how I need to hold myself. Now, there are some of us that naturally sit hyperextended, so they're already sitting really arched in their back. If you're sitting like this, your back is super arched when you're seated, you want to do the opposite. I'm going to pull my rib cage down, a posterior pelvic tilt, like we practice on the ground. So now I've pulled this down here to engage this and align my lumbar spine that way. So this particular sitting position, the adjustment of the hips and back here really depends on how you're sitting. So I'll review just really quickly. If you're sitting hyperextended like this, you want to pull the rib cage down, tuck the tailbone under a little bit, and align the spine that way. If you're sitting really round in the spine, which is actually how I tend to sit, rounded like that, I'm kind of slooping into the seat, then you want to go the opposite direction and stick your tailbone behind you, pull the ribs up a little bit, keeping the abs engaged. Now I'm taller in that lumbar spine. Meanwhile, you're keeping all of the shoulders, neck, everything there at the same time. The very last piece that I'll offer is kind of what you're doing with your knees. Your knees kind of control how your hips are engaging or disengaging. You're going to activate your glute medius by driving your knees out. So if I keep my feet planted, my toes engaged, okay, and I push my knees out, and I keep them actively pushing out like that as I'm seated in this nice active position, you're firing your glutes and you're not doing that much. okay? So just push them out, stay tall in that position, got glutes firing, everything else firing to stay tall, and you're set in a nice stable position. If you want to hang out in a little bit of figure 4, really simple stretch that you could do, pulling the chin back, shoulder blades down. That's one of the things that I like to do if I'm sitting for a long period of time to open the glute and hip. People overlook is simply how we're walking, okay? Similar to the standing exercise that we did last week, where you're pulling your tailbone under and keeping your rib cage down, your shoulder blades back, and your chin back. That is how the spine is supposed to be set when we're in this upright position. Now, how do you do that when you're walking though? Oh shit, okay, well, everything I just described to set you in place, but now incorporate the stepping. Now there's a whole long running discussion and debate about shoes. Wearing shitty shoes is a big factor in how everything works from the ground up. So just set that discussion aside and bear with me and practice doing all of this barefoot at home or wherever you want to walk around the gym barefoot, because how your feet work and how you coordinate your walking from the ground up is very important in how your spine is going to stay healthy. Essentially, and this goes for running as well, if you're jamming your heel into the ground every time you take a step, there will be a jolt up your bones all the way into your hip and therefore your spine. So there's no absorption when you're jamming the heel into the ground. But if you step forward and you absorb the ground with the feet and toes like this, transfer weight, I've absorbed the compression into the ground and created a safer, stronger system all the way up the chain. Now this is super hard to coordinate, okay? So we're just gonna do our best here. Essentially what you wanna think of while keeping all this core engagement, here, tailbone under, keep your posture as solid as you can. I'm going to step my foot forward, spread my toes, strike the ground with my pinky toe knuckle first, then grip the ground with the toes, setting the arch of my foot, keeping the arch of my foot as I transfer my weight forward. Glutes are still engaged. Then I go next foot, spread the toes, pinky toe knuckle touches first, toes grip, foot grips, transfer weight, abs and core still engaged. See how slow I'm moving? It's really easy to walk fast with momentum, okay? There's no stability when you're going slow. Or I'm sorry, there's no stability when you're going fast. But when you go slow, we're causing the brain to focus and activate in the area that we're focusing on. So here we're walking like so. So the main purpose of setting this walking postural pattern, as I said, is to allow the body, the entire chain from the feet up through the legs and into the pelvis and spine, to prevent any repetitive jolting and compression of the body as we walk heels first. We have strong feet. We have this really big Achilles tendon here. We have these calf muscles to be able to absorb walking like that. That's literally why they're there. So use them. Practice that as much as you can. Practice being barefoot and walking like that as much as you can. Now, philosophically speaking, if we're in a rush, it's really hard to do that. So when we're in a rush, we're striking our heel. Try to slow down a little bit. Just be a little bit more conscious. I've practiced this a lot, so I can maintain this at a fairly doable pace. I kind of look like I'm walking funny, but I promise. And notice, my heels are not striking first. My pinky toe knuckle is striking first, and I'm using my toes. Some of you thinking, this is ridiculous, I'm not going to focus on how I walk. But I promise you, it's one of those movements that you have to do all the time. If you're doing it wrong, and I assure you, if you're heel striking, you are doing it wrong, that it is not going to allow you to stay healthy long term. You're going to end up with plantar fasciitis. You're going to end up with ankle and knee issues, which many people already have. So you've got to begin to walk a little bit more functionally speaking. And as far as the philosophy goes, the theory goes behind this walking pattern, the way that I'm offering you is that evolutionarily speaking, we didn't evolve with shoes on our feet, especially big ass cushions on our feet. We evolved either wearing, no shoes at all or wearing very thin things under our feet. So there's no padding and cushion. So we had to walk gracefully and also very presently so that we don't step on sticks, stones, snakes, whatever you're stepping on in the primal days of human walking. So focus on that as much as you can.